Bismillah ar-Rahman ar-Rahim. Continuing our lecture about brain waves. Actually, brain waves are classified according to the EEG. EEG is an electroencephalogram. This EEG is defined as an electrical recording of the activity of the surface from the surface of the brain or from the outer surface. It is performed that by putting an electrodes on the outer surface of the head so that to record the electrical activity from the surface mainly of the cortex of the brain in all its areas. Both the intensity and the patterns of electrical activity is determined by the level of excitation in different parts. Normal healthy people, most waves in EEG are classified as alpha beta, while theta and delta waves are in certain conditions that we will come to it later on. Starting with alpha waves, most of the adult normal activity at resting state is of an alpha wave. This is at a frequency between 8 to 13 Hertz or cycle per second, and it's found in almost, all normal adult people when they are awake and quiet and in a resting state. During deep sleep, the alpha wave disappear and replaced by theta or even sometimes to a delta wave, as we will come to it later on. And it's mainly recorded from the occipital loop, so that it is called the posterior dominant rhythm in EEG. Beta waves occur frequencies greater than 14 Hertz or 14 cycle per second, and as high as may reach even to 80 cycle per second. They are recorded mainly from the parietal and the frontal region during a specific activation of these parts during an intense mental activity. هذا هو الفرق يعني بين الألفا during quiet state بحالة هدوء طبيعي resting state, beta waves during intense mental activity and some emotional state. Theta waves هنا يبدأ الفريكونسي ينقص between 4 to 7 Hertz cycle per second. Occur normally in the children. ليش؟ لأن هم children are evolving their brain activity so that reaching to the mature level. During emotional stress, and also occur in degenerative brain state, يعني when there is an abnormality يعني. Delta waves here is frequencies less than 3.5 cycle per second. They occur in a very deep sleep in infants and in serious organic brain disease, so that it is in adult, it is associated with an abnormality. Also طبعا they in deep sleep يعني onset in the awake adult associated with the serious brain damage or organic brain disease. It could not occur in a normal awaking adult because it may occur in deep sleep. There is a generalized correlation between the level of cerebral activity and the average frequency of the EEG rhythm. The average frequency increasing progressively with higher degree of activity مثل ما قلنا beta. So existence of delta waves in stupor, surgical anesthesia, deep sleep, theta waves in psychomotor states and in infants. Alpha waves, as we said, during relaxed state, beta waves during an intense mental activity. During periods of mental activity, the waves usually become asynchronous rather than synchronous, so that the voltage falls considerably despite marked increased cortical activity. Also احنا mainly record البيتا waves during an eye closed state. احنا من نسوي الكترونسفيلوجرام when there is an opening eye, there will be attenuation of that rhythm. ذلك this is يعني certain stages in performing the ordinary أو the routine EEG maneuver. So that according to EEG there will be also classification of sleep. Sleep is defined as unconsciousness which can the person be aroused by sensory or other stimuli. وهذا اللي فرقنا عن الكوما. الكوما it is unconsciousness from which the person cannot be aroused. يعني ما نقدر انه نفوق المريض من هذه unconsciousness. هذا فرق السليب عن الكوما. Types of sleep. Mainly there are two types called slow wave or non-rapid eye movement sleep and REM sleep. Why? Because this type of sleep of brain waves are very strong of very low frequency. النوع الثاني هو rapid eye movement sleep. This type of sleep that undergoes rapid movements despite the fact that the person is still asleep. Sleep cycle. Normal sleep cycle starts by non-rapid eye movement NREM sleep about 80 minutes, average 70 to 100 minutes, followed by rapid eye movement sleep about 20 minutes, average 10 to 40. The cycle is then repeated again, but again the non-REM sleep start to decrease and with longer rapid eye movement, about 4 to 5 cycles repetition, يعني non-REM ب-REM. Also the second cycle gonna repeat, also non-REM followed by REM, but the first اللي هو NREM start to be shorter and the second, the last REM start to be longer until in the later cycles so that sleep become lighter and non-REM even start to know non-REM the last cycle, all of it of rapid eye movement. The duration of deep sleep periods shorten also with advancement of age. Non-REM sleep is an extremely restful. Most sleep during each night is of the slow wave. Although slow wave sleep is frequently called dreamless sleep, dreams, sometimes even nightmares do occur, but usually not remembered and associated with less bodily muscle activity. It is associated with decrease in both peripheral and vascular tone and many other vegetative functions of the body. As example, 10 to 30% decrease in blood pressure, respiratory rate and basal metabolic rate. In non-REM sleep, 4 stages are recognized, which can be identified by EEG. Stage 1, very light sleep. This stage is characterized by slowing of EEG rhythm and the appearance of small theta waves اللي هو قلنا about 3 to 7 hertz. The person is awakened during this stage. He will assert that he was not asleep but just closing his eyes. This stage occurs only at the onset and at the waking up from the sleep. يعني خلينا نقول الفترة هي البداية، يعني البرسن يقول لك I was not يعني ما كنت نايم، كنت بس ساد عيني in this stage. The stage 2, light sleep. The stage characterized by the appearance of EEG, what is called sleep spindles, and we'll come to it later in the figure, associated with K complex. Sleep spindles are bursts of large waves, frequency of 14 to 15 Hz, last for 1 to 2 seconds, and we will come to it in the figure. Stage 3 is an intermediate sleep. Intermediate sleep characterized by appearance of EEG of rapid delta waves, 3 to 3.5 Hz. Breathing is also slow and even. Pulse rate is about 65 beats per minute. Temperature and arterial pressure continue to decline. Stage 4, deep sleep. This stage characterized by the appearance of EEG of delta maximum waves, delta waves with maximal slowing frequency 0.5 to 1.5 Hz. This stage occur only in the early sleep cycle. There is a maximum slowing of breathing and heart rate, يوصل البيت 60 per minute. May occur, kinestalk breathing may occur in this sleep. This for the first type اللي هو non-REM sleep, non-rapid eye movement. Coming now to the rapid eye movement sleep, also what is called paradoxical or desynchronized sleep. وراح نجي ليش why it is called paradoxical or desynchronized sleep. First type sleep is not so restful. Occur bouts on average about every 90 minutes, about 5 to 30 minutes, occupy about 25% of the sleep time in young adult. وقلنا هو حوالي يوصل بالبداية يبدي ب 80 minute non REM, برابد REM 20. طبعا هنا أنا average in numbers and أنا an average, not a clear cut. As usual associated with active dreaming, vivid dreaming and active body muscle movement. Heart and respiratory rate usually become irregular, which is characteristic of the dream state. ذاك النوع قلنا لا, there is a continuing decline in these activities. The person is even more difficult to arouse by sensory stimuli than during deep slow wave sleep. Yet people usually awaken spontaneously in the morning during an episode of rapid REM. قلنا لأنه during يعني successive cycles of sleep may even حتى نوصل إلى مرحلة non rapid eye movement توصل إلى أنه ماكو, يبقى بس rapid eye movement بآخر cycles of the sleep. Muscle tone throughout the body is exceedingly depressed, indicating strong inhibition of the spinal muscle control areas. Despite extreme inhibition of the peripheral muscles, irregular muscle movement they do occur. Also, in addition to the rapid movements of the eye, the brain is highly active during REM sleep, and overall brain metabolism may even be increased at 20%. The electroencephalograph pattern is similar to that during wakefulness. ولهذا السبب يسمى بالparadoxical sleep. Paradox بمعنى التناقض, يعني أنه it is the EEG, it's an EEG of an awaking person while هو بالحقيقة he is sleeping, وهذا سمي بالparadoxical sleep. So that paradox is still asleep despite marked activity of the brain. هذا قلنا السبب why it is called paradoxical sleep. ثاني الاسم desynchronized sleep because of irregular activity of the vital activities. Coming now to the awakening state, this is an alpha rhythm of the awake state, stage 1 sleep. يبدي قلنا يصير theta activities يحول الرhythm. stage 2 sleep راح sleep spindle, it is burst قلنا of irregular activities with high hertz, you leave to about 12 hertz, followed by K complex, sleep spindle high K complex, also recorded from adult, even from the children also. هذا احنا characteristic بالsleep spindle K complex sleeping EEG of the pediatric. Also in stage 3 sleep we notice that there is delta activity appearing, and in stage 4 sleep it become اللي هو قلنا عليها اللي هي very deep sleep, راح تكون of slow delta activity اللي قلنا توصل 0.5 إلى 1.5. REM sleep اللي هو آخر شيء we will start so that it will return even to something to the normal awake alpha rhythm اللي هو آخر شيء موجود اللي آخر شيء موجود الآن موجود. شوفوا أنه nearly يشبه الأويك ريكورد أول واحد, وهذا سمي بالparadoxical sleep. This is also a comparison لنا REM before REM. طبعا ال REM قلنا usually duration طبعا longer than REM 80 أو حوالي, وذيك shorter 20, بس قلنا the progressive of the cycle يبدي النوع الأول يقل والنوع الثاني يزيد, قلنا حتى يوصل إلى أنه يختفي النوعية الأولى اللي هو non REM، تبقى آخر cycle mainly REM. Depth of sleep variable، بينما بال REM very light. Threshold of the waking stimulant variable، REM high require threshold to wake up. Rapid eye movement طبعا absent in non REM while REM is present. Dreams absent in REM although may occur but it is not remembered, while active and vivid dreaming موجود بال REM. Muscle tone is low in an REM while it's very low in rapid eye movement sleep. Sleep talking and sleepwalking, it may occur in non-REM sleep while it does not occur in REM sleep. Also erection is absent in non-REM sleep while it is present in rapid eye movement sleep. EEG, it's mainly of delta and theta waves in NREM while it's of beta wave in rapid eye movement sleep. Controlling center of non-rapid eye movement is Rafi nuclei while it is nucleus cellulus in rapid eye movement sleep. Theories of sleep. Passive theory of sleep, an early theory so that the excitatory area of the upper brain stem, reticular activating system, simply become fatigued during the waking day and become inactive as a result of that. Second theory is an active theory, so that there is a sleep center, so that where stimulation of a specific area of the brain can produce sleep, like Rafi nuclei of the pons upper medulla, nucleus of tractus solitarius in the medulla oblongata, and several regions in the hypothalamus and the thalamus. Lesions, if they are in the sleep promoting center, can produce intense wakefulness. يعني من تنظر بذن السناتر راح يصير intense wakefulness because the sleep centers are affected. Third, metabolic theory. Substance related to sleep like neuramyl peptide and glucopeptides responsible for it is responsible that possible that a prolonged wakefulness cause a progressive accumulation of the sleep factor or factors in brainstem in the cerebrospinal fluid, and accumulation of these promoting factors lead to sleep. Normal sleep function is to restore natural balance in the neuronal center and to get rid of the accumulated waste products. Prolonged wakefulness associated with progressive malfunction, and it is process in the thought process, sometimes even called abnormal behavioral activity, and it's also badly affecting the brain, may leading even to brain dysfunction if it's continued for a very long time. And in the next record we will about this seizure and epilepsy.